In our globally connected world, disease is just a flight away. CDC has 20 quarantine stations located at U.S. airports and land borders where most international travelers arrive. Quarantine station staff are the first responders of public health, ready 24/7 to detect, protect, and slow the importation and spread of diseases into the United States. Quarantine station staff respond to reports of sick travelers. Together with partners in Customs and Border Protection and Emergency Medical Services, CDC quarantine staff assess, screen, and decide whether sick passengers can safely continue travel without exposing the public to a contagious disease. Sick travelers may be transported to a local hospital for medical exams and care. If they don't have a serious disease that could spread to the community, they can continue their travel. It's our job to ensure one sick traveler doesn't become 100 sick people in your community. When an outbreak overseas, such as Ebola, threatens U.S. communities, quarantine stations may take action to ensure arriving travelers from affected areas are screened, receive health information, and are connected with their state and local health departments. Quarantine station staff enforce CDC regulations on bringing animals, animal products, and biologic materials to the United States. They ensure dogs from countries with a high risk of rabies are vaccinated against this deadly disease. Quarantine staff also make sure biological samples shipped for research have the proper documents and packaging, so they don't pose a threat to anyone handling the material or anyone at their destination. Quarantine station staff respond swiftly to requests from hospitals when certain medications that are available only from CDC are urgently needed. When lives are in the balance and the clock is ticking, quarantine station staff rush these time-sensitive shipments and work with doctors, pharmacists, and CDC scientists to save lives. Saving lives and protecting the public's health at our ports of entry is a combined effort involving CDC, our federal partners, and the public. Quarantine station staff train our partners, such as Customs and Border Protection officers, to recognize potentially sick passengers and coordinate with CDC to intervene, assess, and prevent others from getting sick. They also provide important messages to make travelers aware of current global disease risks and what they can do to protect themselves and their families. Health threats are constant, but so is the vigilance of our CDC staff. Quarantine station staff are the first responders of public health, ready 24/7 to detect, protect, and slow the importation and spread of diseases into the United States.
Now that you know where we've been, find out where we're going. Tune in to Ladies Love Politics, where you can stay informed without going insane.